Hello, this is Dr. Renfrow, and just wanted to answer the question that we get occasionally, if x-rays are harmful or bad for you. So I just wanted to share with you a publication from a scientific journal called Dose Response. The title of the study is 7 Reasons Why Radiography Used in Spine and Posture Rehab Should Not Be Feared or Avoided. This is by Oakley and Harrison. And so I'm just going to go through the 7 reasons very quickly. Number 1, the first reason is that the LNT model for radiation risk estimates is invalid for low dose exposures. What that means is that they used to base their ideas on radiation exposure and the danger of it on a model called the linear no threshold model. The linear no threshold model in this graph is this straight line, which basically means that any amount of exposure to radiation at all would be increasingly harmful in increasing levels. And that was based on information that they had from scientific studies on actually high dose radiation associated with Nagasaki and Hiroshima around the time of the Second World War. However, more recent research on low dose radiation suggests a different type of model called the hormesis model. And so that would be this line right here, wherein low doses of radiation, such as what you would encounter in an X-ray or a CT scan, something along those lines, actually has a beneficial effect on the body. And that beneficial effect is known as hormesis. So we'll talk about this within the next few minutes and other points. But basically, the way that we used to think about radiation exposure is not what we are gradually and continually finding out is accurate about the relationship between the danger of radiation exposure. Number 2 says that low dose radiation enhances health via the body's adaptive response mechanisms. So this is that hormesis idea. Hormesis is basically an adaptive response. Anything that has a mildly harmful or deleterious effect on the body is going to cause the body to respond and adapt by strengthening, just like exercise. So when you exercise, you use weights, you gradually increase resistance over time, and that makes you able to lift more and more weight over time. The body's the same way. That's why it's actually good to be exposed to certain types of dander and dust and bacteria and viruses, because the body can make an adaptation and become stronger by being exposed to those things. Radiation's the same way. Radiation exposure damages living cells slightly to the place where they build back up stronger and stronger. So this is a positive and health promoting response of the body to low levels of radiation. Again, not a high level of radiation, just like you wouldn't go into the gym and try to deadlift 315 pounds the first time, because you'd probably break your back. It's the same thing. But if you go in the gym and you start with light weights, in time you'll be able to work your way up to a heavy weight, because your body is continually adapting and improving in response to the exposure of low levels of stress and physical demand. Number 3, an X-ray with low dose radiation only induces 1/1,000,000th the amount of cellular damage as compared to breathing air for a day. So another idea that we understand is that there is actually radiation all around us. There's a certain amount of background radiation that we just can't avoid. It's a part of everyday life. And so that small amount of radiation and the cellular damage that may result from it is negligible at the least. A scientist named Lemon and his associates documented an increased lifespan in mice who received a single CT scan. and also in mice receiving multiple CT scans. So that's the hormesis effect, is that a low dose of radiation actually makes you stronger, more resilient, more robust. CT scans also emit radiation in the low dose range, but that it's more than what you would be exposed to through conventional X-ray, such as what you would come into contact with in a chiropractic office or an upper cervical office, such as our office. Number 4, radiography is below inescapable natural annual background radiation levels. Again, there's a certain amount of radiation around us at all times that we just can't avoid. A set of X-rays are less than a year's equivalent of background radiation, and maybe depending on where you live, maybe equal to only a few days of natural and inescapable background radiation. So again, rather negligible in the light of what we're exposed to begin with. Number 5, radiophobia stems from unwarranted fears and false beliefs. Basically based on misinformation. Radiophobia has to do with political results of Hiroshima, Nagasaki, and the threat of nuclear warfare in that time, and the scientific community's response by declaring all radiation absolutely and ultimately detrimental to people. So this resulted in a lot of campaigns and scientific response by basically looking at radiation in a bad way, which is the complete opposite of what we understand in this day and time. Number 6, radiography use leads to better patient outcomes, especially in the office where we are documenting the spine, changes of the spine and the posture, for the assessment, for diagnosis, for monitoring of clinical outcomes from what we do in practice. So basically, the only way to provide the best care is through radiography, and it's the most cost effective and it's the most practical type of imaging that can be used in practice. Number 7, the risk to benefit ratio is always beneficial for routine radiography. The authors of this study, Oakley and Harrison, came to the conclusion that really, in light of all of the things that we now know about X-rays, that the risk is basically zero. And so there's only benefit to taking X-rays. And that includes the fact that many detrimental conditions are actually caught through X-ray, especially in the chiropractic office. You can consider things like metastasis from cancer, tumors, aneurysms, things like this can be viewed on X-ray, and a lot of times are caught because of a routine X-ray. So it may be more dangerous to not get a diagnostic imaging procedure when indicated. So I hope this helps answer your question. If you've ever had the question of whether or not X-rays are harmful, or what is the clinical benefit of X-rays in practice. Thank you. Goodbye.